Hi, do you think that causes of back pain are exactly the same in men and women? It might appear so because the structure of the spine is the same, but it is not actually so. The stress and strain and the hormonal changes that the spine is subjected to are totally different in men as well as in women. And that is one of the reasons why women are more likely to develop back pain as compared to men. This is due to the several changes their body undergoes through the lifetime of a woman, and there are several phases. Of course, one is pregnancy. So during pregnancy, to accommodate the baby, the ligaments have to be relaxed, and that is why the body secretes a hormone, something called as relaxin, and this relaxes the ligament in the spine also. And the pressure of the pregnancy, the pressure of the womb, also presses on the spine and sometimes can change the curvature of the spine. So even minor underlying spinal problems can become more severe during pregnancy. Apart from the changes in this, the woman can also develop problems during menopause. After menopause, due to changes in the hormone, the bone becomes weaker, much faster in women and much earlier as compared to men. In men, usually it takes around 65 to 70 years for the bone to start becoming very weak. But in a female, this process starts immediately after menopause. And that is why women are more prone to developing osteoporosis, fragility fractures, as well as what we call as a hump in the back, the Dowager's hump, that many women become very stooped as they become older. And these are due to osteoporosis and multiple small compression fractures over a period of the lifetime. Now, that is why preventive measures are also very important in females. And that is why during pregnancy, it is stressed that the lady should do regular exercises, do back strengthening, core strengthening exercises, relaxation exercises, not only during pregnancy, but immediately after that, where the body or the muscles or the ligaments return back to normal. Even if there is a back pain during pregnancy, because as the body gets back its normal shape and as the woman comes out of the pregnancy, the hormonal changes usually are reversed and this back pain that has appeared during pregnancy comes down. But only in cases where the back pain continues for a longer time even after pregnancy. These are not due to the effect of pregnancy. For older females, especially while reaching menopause, it is very important to take into factor the bone loss that happens as the female crosses the age of menopause. So usually in those cases, the precautions are very important. Regular exercise, 30 minutes of walking, brisk walking has to be done. Second thing, calcium and vitamin D supplementation. So you should take anywhere between 500 to 1000 international units of calcium every day. Plus, you need to take vitamin D around 500 units every day. So this is something that is very important because a vegetarian Indian diet does not give adequate amount of calcium and it has to be supplemented. You can either drink 2 full glasses of milk or you can start taking calcium tablets along with vitamin D. The third thing is avoid falls. Whenever there is a bone weakness, even a trivial injury can cause a fragility fracture. So in these cases, you have to be very careful to avoid even a trivial injury or a trivial fall. Now with exercise, calcium and vitamin D supplementation, usually the onset of osteoporosis can be delayed or can be prevented. But in some cases, it becomes important to take additional treatments. Like say, for example, nowadays there are so many drugs that are available to prevent osteoporosis or to preserve the quality of bone. And these can be either hormones, these can be usually anabolic agents like we call as teriparatide and all those other drugs. And even the newer drugs of denosumab or romoluzumab, these also are useful in preventing or reversing the effects of osteoporosis. And in cases where osteoporosis leads to complication, that is if there is a fracture, if there is an injury or if there is a progressive hump, especially an acute fracture can be treated with modern minimally invasive techniques. A simple injection of some bone cement, what we call, into the bone or restoring the height of the bone by what we call as a kyphoplasty. A balloon kyphoplasty. A balloon is inserted into the collapsed bone. It is restored into its normal height and then the cement is filled into the bone to preserve that height that we have restored during surgery. So these simple things can be done as minimally invasive procedures and they give excellent outcomes in patients who have actually suffered a complication of osteoporosis and actually have a fracture which is not mild and which is not healing with conservative treatment. Well, it is no hidden fact that a woman is the backbone of every family. And it's our job to make sure that her literal backbone is strong enough to carry the weight of the entire family. So remember, ladies, taking care of your spine is not about vanity. It's about preserving the strength of the spine and keeping it strong till the end to accommodate or to be able to carry the strength for carrying out all the activities that are yet to come in your lifetime.